Well, Robert F. Kennedy Jr. is bringing his Make America Healthy Again push to the Lone Star State. He'll share the spotlight this week with Governor Greg Abbott to zero in on one of the nation's toughest challenges, rural health care. Kennedy points to rising chronic illness with hospitals closing at a record pace and doctors in short supply, claiming the crisis is leaving Americans in these areas without the most basic care. Joining us now is nephrology specialist Dr. Frita, founder of Midtown Atlanta Nephrology. Doctor, great to have you. Good morning.
Good morning, Kelly.
So tomorrow, as you know, the Governor Greg Abbott, he'll be joined by Secretary Kennedy to discuss rural healthcare initiatives. We know Texas leads the nation in rural hospital closures up to this point. 26 since 2010, 76 more considered at high risk now. What are the biggest factors under consideration here? And would you mind describing how critically needed these hospitals really are?
These hospitals are so needed, Kelly, because they take care of people who don't have the transportation to get to big cities. Perhaps they don't have the funds to be able to afford to get there and get treatment. It can be the matter of life or death, especially when you're dealing with maternal mortality, women going into labor. It's important that these rural hospitals remain, especially in a place like Texas.
Yeah, and we know the governor there, he already signed one of the most aggressive MAHA initiatives yet, requiring the food industry to either remove more than 40 harmful chemicals and additives from processed foods or add warning labels. We know also other states have signed MAHA-related laws as well. How widespread do you see that ban becoming here in the U.S., and what are the implications of that, perhaps?
Oh, I actually think that this bill, or actually now a law, the Make Texas Healthy Again law, is wonderful in many aspects because we're going to have increased improvement in nutrition as far as food labels. It's going to promote physical activity for kids, and it's going to make it where teachers are not allowed to punish kids by keeping them from being physically active. That's very important because we know there's an increase in obesity and in diabetes. We also know that it's going to increase the nutrition educations, not only in primary and secondary schools, but also in medical schools. I do have to say, though, that in a lot of ways, while I do support the Make Texas Healthy Again law, I think it's wonderful in many ways. Governor Abbott and RFK Jr. are actually a bit paradoxical, like a walking conflict, because at the same time, they promote many policies and theories that can actually be detrimental to the health of Texans. Case in point, we know that RFK Jr. has historically spread a lot of misinformation about the measles vaccine, for example, and we have a rise in measles. And so I just think that we need a lot of consistency from leadership, and this is a good start, but we definitely need more in order to make Texas and America healthy.
Well, I want to ask you about something that's also come under the microscope. Texas is one of many states removing junk foods from SNAP programs. And advocates report, 25% of SNAP dollars go to candy and soda, that this is a major win. But critics argue it's taking away free choice. So what are your thoughts specifically on those moves?
My thoughts are that instead of being punitive and taking away the SNAP benefits, there should be more weight on the education. A part of this initiative is to make sure that in grades kindergarten through 8, that there are nutrition courses, and even in high school, they are requiring nutrition electives. I believe that the education should be given to families, including families who have low income, families in food deserts. And then with that education, then they can make better choices. But when we start taking away choice from people, especially people with low income, it's a slippery slope. So I don't agree with that aspect of this initiative.
Yeah, well, that's the argument quite a few folks are making now that it's been implemented. Dr. Frita Fisher, wonderful to have you. Thanks so much for being here.
Thank you.